One of the most sobering truths about the liver is that it can suffer for years, sometimes decades, without making a sound. Unlike the heart, which protests loudly with chest pain, or the stomach, which reacts with nausea and cramps, the liver has no pain receptors. It doesn't alert you when it's inflamed, fatty, overburdened, or even beginning to scar. This silence is not a sign of strength, it's a vulnerability. It allows liver diseases like non-alcoholic fatty liver disease, NEFLD, hepatitis, fibrosis, or even cirrhosis to progress slowly, quietly, and dangerously beneath the surface until damage is severe and often irreversible. This silent suffering is one of the liver's most defining characteristics. It is incredibly resilient, able to regenerate and compensate even when a significant portion of its function is compromised. But that same resilience allows damage to accumulate undetected. By the time symptoms like jaundice, abdominal swelling, chronic fatigue, dark urine, or easy bruising appear, liver function has typically declined dramatically. At that stage, treatments are more limited, and recovery becomes more difficult. Fatty liver, now one of the most common liver conditions globally, often develops without a single symptom. It is estimated that up to 25% of adults worldwide have some degree of fatty liver disease, and the majority have no idea. The condition is frequently discovered incidentally, during imaging for unrelated issues, or through mildly elevated liver enzymes on a routine blood test, which are often dismissed or downplayed. Yet if left unaddressed, fatty liver can lead to inflammation, non-alcoholic steatohepatitis or NASH, fibrosis, and eventually cirrhosis, a condition where liver tissue becomes so scarred and dysfunctional that a transplant may be the only option. And cirrhosis itself doesn't cause pain either. The liver continues to try to compensate by redirecting blood flow, regenerating tissue, and increasing its workload. But the consequences creep in: fluid retention in the abdomen, ascites, esophageal varices that can bleed, impaired mental function from rising ammonia levels, hepatic encephalopathy, and a high risk of liver cancer. All of this may begin to manifest only when the liver is nearing failure, when it's often too late to reverse the course. This slow-burning nature is what makes proactive liver protection not just wise, but necessary. Waiting for symptoms is not a strategy. By the time the liver signals distress, you're already deep into the danger zone. Instead, the key lies in early awareness and steady, preventive care. Fortunately, the liver is one of the most forgiving organs, if given the chance. Catch problems early, reduce the load, and it will heal. Remove harmful exposures, support its core functions, and it will regenerate. Even early-stage fibrosis can sometimes be reversed with the right approach. That approach doesn't require radical change, just intentional, consistent care. Reducing alcohol, avoiding ultra-processed foods, and limiting high-fructose corn syrup are foundational steps. Increasing dietary fiber, particularly from whole vegetables, fruits, and legumes, supports bile flow and detoxification. Getting regular exercise improves insulin sensitivity and reduces liver fat. Drinking plenty of water, prioritizing sleep, and managing chronic stress all reduce inflammatory pressure on the liver. Specific nutrients like choline, B vitamins, selenium, and antioxidants such as glutathione or alpha-lipoic acid can also play a direct role in liver function and repair. Blood tests like ALT, AST, and GGT can provide clues, but don't always tell the full story, especially early on. More detailed assessments, like a liver ultrasound, FibroScan, or MRI elastography, can offer a clearer picture if liver health is in question. Unfortunately, routine screenings are not often done unless there are clear risk factors like obesity, diabetes, or known alcohol use. This is part of the systemic blind spot. The liver silence has translated into a lack of urgency in preventive care. But that silence should be a call to action, not an excuse to ignore it. The liver is not loud. It will not cry out until it's drowning, but it will show subtle signals: fatigue that doesn't lift, a foggy brain, hormone imbalances, or nutrient deficiencies, that something is off. And even before that, we can act based on knowledge, not symptoms. Supporting your liver is not about fear. It's about respect. Respect for the fact that it never stops working, never asks for recognition, and takes more abuse than most organs could handle without complaint. And in return, it gives you the foundation for life itself: energy, clarity, balance, resilience. So don't wait for warning. Don't wait for pain. Listen instead to what science and wisdom are already telling us: that the liver is the quiet guardian of health, and like all guardians, It deserves our protection before the threat arrives. When we protect the liver early, we give ourselves the gift of long-term vitality without ever having to hear it scream.